Got it. Okay. Hi, everyone. Thanks for being patient. I apologize for the slight delay. So I'm just going to introduce myself. My name is Dr. Sada Floaty, and I am an OBGYN in New York. And just a little bit of background. So I received my education through Michigan State University, College of Osteopathic Medicine. That's where I got my medical degree from. And then I went ahead and did my residency in Michigan and came out to New York. And I am an OBGYN, practicing OBGYN, as well as a sex and intimacy coach here in New York. So today we're going to be talking about the sexual health conversation and notes from a Muslim gynecologist. That's me. So I'm going to go ahead and get started. Let's see here. So before I start talking to you about the topic at hand, I just wanted to go over a few things that I hope you'll walk away with today. And these were the objectives that are listed. So I'd like for whoever is watching to understand how comprehensive sexual education leads to improved societal outcomes, learn how to support those in charge of sexual education, and of course, create a more sex-positive culture. So what we have here is some facts just to get our conversation started. And we have these next few slides are maps of the United States that reflect different aspects of sexual education here. They're taken from the Guttmacher Institute. And for those that are unfamiliar with or don't exactly know what the Guttmacher Institute is, it's a leading research and policy organization that is committed to advancing sexual and reproductive health and rights worldwide. They focus on high quality research, evidence-based advocacy, and strategic communications. So here we have a map of the US, and almost every state has some guidelines on how and when they teach sex education, but the decisions about that curriculum are vast, and the implementation is often left up to the individuals in those school districts. So this results in inconsistent and policies and practices that vary with each state and across the country. And in many cases, even the sex education that someone receives can be determined by the district that they're in and even the individual school that they attend. This results in a lack of standardization for our sexual education in the US. And the standards for the sex education across the country are insufficient and often inconsistent. So what this map shows is basically states that require sex education in the United States. Those are colored, those are shaded in red. And the other states that are striped are those that require medical education or sexual health education to be medically accurate. What you'll notice is that the two are not necessarily overlapping. And this is a problem for two reasons. First and foremost, that not all states are requiring sex education, even though all states have guidelines, not all states mandate the education. And secondly, the information that's being taught in some states is not necessarily scientifically based or research-backed information. The states here that are colored in red do not require sex education. And as probably you could understand, is that some states do not consider it necessary for today's youth. So the gap between sex education, what students need, and what they're actually getting is quite vast. According to the CDC report in 2018 on school health profiles, fewer than half of high schools and less than a fifth of middle schools were teaching all 20 topics that were recommended by the CDC as essential components of sex education. Now, these topics range anywhere from transmission of HIV and other sexually transmitted infections to prevention of these infections to communication, and lastly, making informed decisions about our bodies or children's adolescent bodies. Young people are not getting the sex education that they need. And in fact, only half of adolescents, so 53% of females and 54% of males, reported in 2015 that they had barely received sex education that met the minimum standards required by Healthy People 2030. So Healthy People 2030 is an initiative by the U.S. Department of Health and Human Services that requires a minimum set of topics that must be covered in formal sex education, such as dealing sex, sex education, using birth control, and preventing sexually transmitted infections. And among the teens that were reporting penile vaginal intercourse, fewer than half received this instruction before their first sexual encounter. In 2015 through 19, more adolescents reported that they had received instruction about saying no to sex and or waiting until marriage, as opposed to where they could get birth control or how to use a condom. Currently, 38 states and the District of Columbia require some form of sex and HIV education. However, the information doesn't have to be medically accurate. This map highlights states that need to include information on abstinence, but not on contraception. So adolescents were found to get their information mainly at school or religious institutions or even at community centers. Most adolescents, they said that they received less education on key topics such as birth control in 2015, as opposed to adolescents that received information in 1995. In fact, in 1995, over 80% of male and females learned about birth control methods, whereas in 2015, only a little over 60% reported instruction on birth control. The type of education that adolescents received also depended on where they were getting their primary information from. So for example, if they were receiving their education at school, they would get information about birth control. But if they were receiving that information at, say, like their religious institution, then the information would be focused heavily on abstinence or waiting until marriage to have intercourse. Here is another example of the lack of national standards on sex education that notes that only 8 states require education around consent. So the question comes up, why should we care? And now I'm going to go over a few reasons why we should care. So in these next few slides, we see some of the societal issues due to inconsistent and insufficient sex education. The first being teen pregnancy. So in this slide, we see that 1 in 4 teen births is to a young woman between the age of 15 and 17. That's nearly 1,700 babies every week, and 83% of the women that were having intercourse said that they never received information about sex prior to initiating sex. The result of sex education policies becomes more clear when considering that in 2016, the United States had the highest rate of teen pregnancy and sexually transmitted disease than any other industrialized country. And that's, of course, according to the Guttmacher Institute. So here is another slide, and just to give you a little bit more information on what teen pregnancy is resulting in. So we see that daughters of young teen mothers are 3 times more likely to become teen mothers themselves. Fewer than half of the teen mothers who have had a child before they turn 18 have a high school diploma, and fewer than that, fewer than 2% will earn a college degree by the age of 30. 80 teens get pregnant every hour, and nearly half of the teens have never considered what pregnancy would do to their lives if they became pregnant. And again, sons of teen mothers are twice as likely to end up in prison. The top point here, it says in the US, teen childbearing costs taxpayers $9.4 billion, and that's actually an outdated statistic, because now we know that teen pregnancies in 2022 cost US taxpayers about $11 billion per year, higher than the amount stated on the slide. And the cost actually is due to increased health and foster care, increased incarceration rates among children of teen parents, and lost tax revenue because of lower educational attainment and income among teen mothers. We see here in this slide that the rates of sexually transmitted infections are increasing every year, and this is from the CDC. So in 2014, you can see we had about 1.9 million, and now in 2019, we have about 2.6 million. According to the CDC, people aged 15 to 24 only make up 25% of the American population, but they account for nearly half of all the sexually transmitted infections here in the US. Here's another slide talking about the cost to the US healthcare system in billions each year due to sexually transmitted infections. So what we see here is that the CDC's latest estimate indicates that 20% of the US population, or 1 in 5 people, had an STI on any given day in 2018. Sexually transmitted infections acquired that year cost the American healthcare system nearly $16 billion in direct medical costs alone. We also see the breakup here of where the money is distributed and the cost based on the type of sexually transmitted infection. We see here HIV, human papillomavirus, and all other sexually transmitted infections. In fact, chlamydia, gonorrhea, and syphilis combined account for 1.1 billion. And the important statistic here is that care for women actually represented 75% of all sexually transmitted infections related direct lifetime medical cost. Okay. Another thing that I think is important to focus on, so we talked a little bit about teen pregnancy, we talked about sexually transmitted infections, but something that we don't talk about often enough is intimate partner violence. It's important to note that according to the CDC, sexual violence affects millions of people each year in the United States. And researchers know the numbers underestimate this problem because in many cases are underreported. So here in the slide, we see that over half of women have experienced some type of violence during their lifetime. Almost 1 in 3 men have experienced sexual violence, according to this slide, during their lifetime. And here, the last thing on this slide that we notice, it says estimated lifetime cost of rape. And so when we go into that, we see what they're talking about, what the CDC is talking about here, is that what the estimated cost of rape refers to is health categories such as injuries, depression, PTSD, substance abuse, cervical cancer, rape-related pregnancy, and costs related to criminal justice response. For example, investigating the crime, adjudication, and incarceration. Victim and perpetrator lost productivity and property loss damage during the offense. The CDC estimates that the per victim lifetime cost of rape is this $122,461. So that's what that number is referring to. So do we have any evidence of efficacy of sexual education? What I'd like to go over now is basically understanding how comprehensive sexual education leads to improved societal outcomes. So in this little picture here, we know that the purpose of comprehensive sex education is to provide people with accurate and complete information about sexuality and relationships, which can help them make informed decisions about their sexual health and well-being. And the benefits include reduced rates of unintended pregnancy, decreased rates of sexually transmitted infections, and of course, decreased rates of intimate partner violence. In this little graph, or in this little slide here, what we note is that we have states that do not require comprehensive sexual education. And of those states, one of those states is Texas. And Texas here ranks number 3 in the highest rates of teen pregnancies. And we also see here that in New Hampshire, they require comprehensive sexual education, and they have one of the lowest rates. In fact, they're number 50 in all of the 50 states for teen pregnancy rates. Here, this little picture compares sex education and teen pregnancy rates. We see that some of the states that do not require sex ed to be taught have the highest rates of teen pregnancies. So if you look on this picture here, you'll see that you have this polka dot picture up on top, and you see those states that have the polka dot, and those states do not require sex education to be taught. And some of those states actually end up being those that have the highest, some of the highest teen pregnancy rates here in the US. We also know that by teaching comprehensive sexual education, we see a correct and consistent condom use that protects people against sexually transmitted infections and have shown to be 98% effective in preventing teen pregnancies or pregnancies in general. Comprehensive sex ed, we know, improves overall physical and emotional health by teaching individuals about the importance of consent, communication, power dynamics, healthy relationships. They can, of course, also prevent intimate partner violence through education and awareness. And we see the drop here by looking at this graph. We see the drop in the rate of sexually transmitted infection since we've had the scale up of condom use. Another key to better sex ed is to focus on gender and power. And so when you teach gender equality and emphasize power dynamics, both people take agency over their sexuality and are likely to have reduced sexually transmitted infections and unintended pregnancies. And you see the difference there between 80% versus 17% and how effective these programs are. So what can we do? What would be next steps? It's important to learn how to support those in charge of sexual education. So what we can do, I think here, is advocacy to support legislative change. We can find out what sexual advocacy programs are. We can contact our local representatives and senators and tell them to support the teen pregnancy prevention programs and the personal responsibility education program, and try to put an end to the abstinence only until marriage program and the sexual risk avoidance programs, because we know that those programs don't work. We can urge our representatives to support sex education programs and ensure that all young people have access to sex education, regardless of where they live. Ensure enforcement of current legislation. So one of the most important things we can do is find out laws in our states. Find out if we have comprehensive sexual education in our state, and if we do, then to contact our local school districts to see whether or not that they're actually being followed. If they're not, or if they don't exist, then we can speak with our local representatives regarding comprehensive sexual education. We can also engage at the local level through school boards. We can go to the school board and find out what sex education looks like in our districts. We can organize with other parents to ensure that schools are teaching comprehensive sex education. You can also contact the American Academy of Sexual Educators, Counselors, and Therapists to get a certified counselor and educator in your area to teach your school district. It's also important that along with advocating for comprehensive sexual education, we work and promote ways to increase access to not only just sex education, but have strategies in place to prevent intimate partner violence. And here's a little schematic of things that can be done. So for example, we can teach safe and healthy relationship skills, engage with influential adults and peers, disrupt some of the developmental pathways to partner violence, create protective environments, strengthen economic supports for families, and of course, support survivors to increase safety and lessen harms. And lastly, what are some things that we could do to create a sex positive culture? Well, first, we could advocate for medically accurate and culturally inclusive sex education. This means education that includes safe sex and pregnancy prevention, alternative gender and sexual identities, sexual and reproductive health, the importance of building healthy, intimate relationships, and the recognition of sex as a healthy and legitimate human need. We could provide a supportive family environment that fosters healthy and open communication, even when it comes to uncomfortable topics. We can volunteer with women's organizations that advocate for sexual health and reproductive rights. We can discuss the concept of consent with our loved ones and clarity in this issue can diffuse any misunderstanding or feelings of shame. We can respect our boundaries as well as the boundaries of our partners. We can accept and be kind to know what our body looks and feels like. We can explore and understand our own body and know our physical and emotional needs and desires. We can refrain from being judgmental about other people's sexual preferences and identities. And lastly, we can know that it's vital to treat sexual health as an important part of overall physical and emotional health. And that is it. Thank you so much for tuning in and listening to my talk on comprehensive sexual education.